International Hospital OS is a blockchain-based platform for clinics and medical centers. Hospital OS is part of the D-Health ecosystem. D-Health Hospital OS solutions help you share health information without errors or delays, keep data safe, and save lives. Add an appointment to your schedule. Choose a doctor from any country. Add online consulting and home visit services. Choose the convenient time slot with any time zone 24/7. Automate your admission notifications. Manage online correspondence with the doctor. Get a complete history of appointments, including lab results and examination reports. D-Health Hospital OS protects your private data. Information is securely protected at D-Health Hospital OS. At D-Health, it's as reliable as a bank, only for a clinic. A data owner can track where his or her data is used. Connect to decentralized healthcare and use HLT, your health token. Join Hospital OS and pay less with HLT tokens.
Hello to all our viewers. Due to Russian aggression against our lovely and peaceful Ukraine, we had to pause the release of our monthly digest of digital health news. But there is so much going on in digital health, so we decided to get back on track even though the war hasn't ended yet. So here are some of the most interesting news happened in April. First of all, we'd like to mention how telemedicine came to rescue hundreds of patients who can't get a professional medical consultation because of war happening in Ukraine. Our company BK created a telehealth platform doctorsforua.com, where all Ukrainians can get medical help by professional doctors from all over the world free of charge. Please share information about Doctors for UA so more people can get help. Plus one in the list of digital health unicorns. AI-backed remote monitoring and digital therapeutics company Bioformis raised $300 million in Series D funding, boosting the company to unicorn level with a valuation of $1.3 billion. The company plans to invest in clinical trials to develop digital biomarkers and expand its digital therapeutics pipeline. Alio announced it earned FDA 510(k) clearance for its remote monitoring system that collects data on skin temperature, auscultation, or internal body sounds and heart rate. The system, which received the green light in late March, is made up of the Smart Patch wearable sensor, its bedside hub, which collects and uploads patch data, the Alio Medical Cloud that stores that information, and clinician-facing portal. AI-backed clinical data startup Mandel raised $40 million. The startup offers AI products that make sense of unstructured clinical information like EHR data, so it can be used for research and analysis. The startup said it plans to use the capital to hire for its AI and engineering teams. Fujifilm develops AI tech for predicting Alzheimer's progression. A clinical trial has shown that it can predict AD progression with 88 and 84% accuracy in American and Japanese patients respectively. Great results indeed. That's it for today. Stay safe and stand with Ukraine.
which medical device is most used not only in medical institutions but in every home. It's a blood pressure monitor. Back in 2010, the study showed that the method of measuring pressure can provide us with much more information than ever. And based on these results, such an opportunity was implemented in Aranta Au software. Now, you can determine the likelihood of heart disease, vascular disease, autonomic and central nervous system disease, and mental illness. Identify levels of stress, psycho-emotional burnout, and depression. Now, with the help of a blood pressure monitor, every average person can track a bigger number of health indicators and make an appointment with a doctor in time. As for doctors, they can use Aranta Au to significantly reduce their workload. They can save time on pre-examination and improve the diagnostic accuracy. Most importantly, get to upgrade the quality of treatment efficiency. In addition to physicians, this technology allows for innovative changes in sports and fitness, military, space, and even veterinary fields. Examples of applications include assessment of professional suitability, psycho-emotional and functional states in athletes and employees, high-risk professions, using technology in the Ruffier and Martina Kushelevsky test, pediatrics, athletes, military, current monitoring of the effect of anesthesia during surgery. So how does Aranta Au work? It is as simple as 3 easy steps. Create a personal dashboard and log into your account. Then connect your mobile app to the blood pressure monitor. The mobile app receives a signal from the blood pressure monitor. Then it uploads the data to the web app. On the personal dashboard, you get to see your current results, predictions, risks, and diseases. Want to monitor your health on the go? Use the Aranta Au software to access the data anytime and anywhere.
Radioprom is a research and development company providing, under different brand names, X-ray medical imaging and diagnostic equipment compliant with European regulations. Breast cancer and lung diseases are health-threatening conditions and among leading causes of death in Europe. X-ray imaging is a gold standard for early diagnostics and thus was extensively used, especially during COVID-19 pandemic, for CT imaging of lung that increased population dose and cancer risks. Our fully digital imaging platforms for X-ray mammography and chest radiography have the highest spatial resolution. By reaching that technical level, we met a paradox of high spatial resolution. The more details we can resolve, the harder and slower diagnostics go. Radiologists must spend more time retrieving diagnostic value from high-resolution images. To solve the problem, we develop and implement artificial intelligence-assisted analysis of detailed X-ray images. To reduce the dose loads, we would improve our preview feature that analyzes X-ray density of tissue and suppose proper equipment settings for examination. Here, artificial intelligence will assist technicians. To further increase the diagnostic value of the high-resolution X-ray imaging, we will introduce a combination of X-rays with optical near-infrared visualization of hemoglobin concentration in the mammary gland. Such combination would distinguish malignancies from benign tumors. All those ideas are in the air now, and we already started innovations. We need European support right now to ensure fast delivery, to pass the ready-to-market stage and provide TRL9 in 2 years. The need for fast and high-quality diagnostics is ever growing, with recent unexpected bursts of respiratory pandemics. Our advantages over competitors are lower production costs, higher spatial resolution, artificial intelligence-assisted image processing and diagnostics, our own software with RIS and PACS compatibility. We've assessed risks and have mitigation measures. Our innovation is very much in demand for practicing radiologists to save them from fatigue and maintain workflow with high-resolution imaging. Artificial intelligence-assisted examination is in need for patients to reduce dose loads. And for the society, we may increase population dose with our innovation. Payoffs for the company, in case of success, are going to be entering the European market with our own brand name, securing costs for investments into further developments. We are research and development team. on the edge of Europe, at the edge of technology.
We are Van & Go and we solve the last mile logistic problem. Growth in last mile delivery had been strong for a number of years, posing challenges for business but also driving steady innovation and progress. Then came the pandemic. The steady expansion gave way to a sudden chaotic explosion in demand. In example, US e-commerce showed 10 years growth in just 3 months in the first quarter of 2020. More and more consumers become used to the convenience associated with online shopping. So, demand from consumer side for quality last mile delivery is on the table and still growing. Most of companies are not ready to meet such a demand, despite it becomes a vital question for them to survive. They need to transform their internal logistic capacity first to provide high-quality last-mile logistics service. That takes time and money. Meanwhile, this results in frustrated consumers who may not remain loyal and hence loss of revenue. 84% of online shoppers would not return to a brand after a bad last-mile experience. But satisfied consumers from last-mile delivery spend 12% more at the retailer. Hi, I'm Kate Restsova. I'm head of product in Van & Go company, and we solve the last-mile logistic problem. What is Van & Go? Van & Go is an AI-based cloud platform that connects businesses and individuals with a network of drivers. The platform works as one technical and financial window for enterprises and allows to plan, control, and execute last-mile delivery. It is based on 3 key pillars. First, Control Tower, the mass brain of the system that connects operations in one place. Then, Driver Application and Client Application to interconnect all delivery parties in real time. What's unique about us? Gathering data during each delivery, we unlock its potential to decrease our cost versus market. Enterprises can roll out quality last-mile delivery function fast and with zero capital investment. We aim the result, so offer the price per drop-off versus time-kilometer pricing models. We have changed the paradigm. Now consumers choose and track when to receive the delivery and get transparent brand experience after checkout. We have a high-tech under the hood, like vehicle routing problem and dispatching algorithm that allows to provide the faster and the cheapest way to deliver. Owing to demand prediction and dynamic pricing, we have no delays and provide our delivery partners with fully transparent solution. The eye of the system is computer vision. It is the complex of solution that allows us to speed up operations with delivery items. Fast and seamless integration with all internal systems of enterprises is possible through our own open API. So, how are we supposed to win the market with our product? Let's get closer to big numbers. Global last-mile delivery transportation market accounted for $287 billion in 2019 and expected to reach $424 billion by 2027, growing at a CAGR of 5% during the forecast period. While on-demand logistic market expected to grow with higher pace, we see CAGR at level of 21 and reach $75 billion by 2027. Our ambition here is to aim top 3 player on each of operational markets with 30% market share. We are on the way to this aim already. Founded in 2019 in Tallinn, Estonia, we right after B2C MVP test, pivot and focused onto B2B model. Since the first B2B client onboarded in November 2020, we have reached 100,000 orders in just 10 months and continuing our expansion. Our expansion strategy is to grab low-hanging fruits on premature last-mile markets first. Meanwhile, to sharpen and increment the product. And only after that, enter highly competitive US, Canada, and Asia-Pacific area country market. Competition is intense there, hence beatable. But mostly we are competing to hit the speeds floor and price ceiling. Our business model stands on the key pillar. The more money our client earns, the more money we earn. While revenue comes from a delivery fee, we also utilize non-logistic fleet and data to get the cost advantage versus market. We are in B2B model for a year now, and here is where we sit today. We are operating in 6 countries, 9 cities. Countries are Estonia, Germany, United Kingdom, Ukraine, Kazakhstan, and Azerbaijan. We are proud of our team that grew up for over 60 people on board, including engineering, product, sales, marketing, and people and culture. And of course, we have a strong advisory board. We are constantly developing our product on the edge of latest trends. Our roadmap has multiple upcoming functionalities. We want to incorporate B2B web access, create platform where business can sell and buy logistic capacity, create marketplace plugins, improve AI dispatching system, and play with new R&D technologies. Thank you from the entire Van & Go team. And let's easily deliver what's hard to move.